DocTalk is brought to you by MultiMan USA, manufacturers of MultiMan 90, Sure Trace Mineral Supplementation by Timed Injection.
Hi there and welcome to DocTalk. I'm Dr. Dan Thompson here at the College of Veterinary Medicine at Kansas State University. We're sure glad you joined us today for our show. We're going to be joined by Dr. Matt Messner, who is an assistant clinical professor in the Veterinary Medical Teaching Hospital at Kansas State University. We're going to talk about Johne's disease and what it entails in both small ruminants and cattle. Stay tuned.
We've been using MultiMan for about 7 years. It's one of the most multi-use products that we have here on the farm. Bulls, cows, calves, weaning age cattle, just about everything on the place. If they go through the chute, they get a shot of it. The primary use that we started MultiMan was in our donor program, in our embryo transplant program. I'd recommend MultiMan to any producer in the cattle business. Here at Deer Valley, every animal that goes through the chute gets a dose of MultiMan.
This segment is brought to you by Purple Wave Auction, the easiest, most straightforward way to sell used equipment. Purple Wave, straight, simple, sold. Well, Dr. Messner, welcome to the show today.
Glad to be here.
Well, it's always fun to have you here. You always bring some practical information and something straight off whether it's the clinics that you're working here at K-State or some experience that you're having out in the field. And today's no different, is it, with Johne's disease?
Right. You know, Johne's disease is something that, at least out here in beef country, it's a little less known. You know, the producers are a little less aware of it. In the dairy side, you see a lot of it. And what Johne's is nothing more than a bacterium that was discovered over 100 years ago.
Wow.
You know? And it's a bacterium that gets into the intestinal tract of cattle, sheep, goats, and they can't get rid of it. And so what it does is it just causes a bunch of thickening of the intestinal tract, and they can't absorb nutrients. And there's just, it's one of those bacterium that are just a horrendous thing to have when you get it into the body.
So it's kind of like a chronic, persistent infection of the gut.
Sure. You know, it's a bacterium that they pick up as a calf or a lamb or a kid early on in life, and it's such a slow-growing, smoldering infection that they don't really show clinical signs up until they're 4 to 6 years of age. You know, so it just sits there and brews inside the body.
So it's contained in the environment or in feces? Is it fecal-oral transmission?
That's another thing that's tough about the bacterium, is it actually is maintained in the body, in the intestine, but once it gets into the environment, it may stay in a nice, moist, warm environment for a year or better, and can still be infective at that stage. So they can pick it up later on and pass it on to young animals later on.
Gets back to some of the importance of just general maintenance and cleanliness and water tanks and.
Absolutely. You know, it loves moist, it loves the biofilm kind of on waterers, it loves mud, it loves pond areas, you know, those kind of things. And like I say, it doesn't replicate in the environment, unlike others, but it has to be in the
what's
body.
there will live and will survive. So when we start to think about, you know, the progression or the pathogenesis of this in the body, from what you're saying is that calf could have it, we'd have no idea until it gets older. Right, and
depends on how much it actually takes in. When they're young, they absorb a little bit more, or their guts aren't have as great of an immune system, but they can. It just gets into their system, and the body just can't get rid of it.
What kind of percentages are we talking about out there in the?
Well, I'll tell you, the last kind of numbers I've seen in that they would say that up to 1 out of 10 cattle running through a sale barn or an auction thing can be infected with it, and you may not know it. You know, I mean, that's the thing. The clinical signs there's only a small percentage that actually show clinical signs, but they're the ones that keep it in the environment.
Probably gets back to one of those things that when you get into some of these endemic herds, the prevalence goes up and we start to see more of an issue. So when we come back out of the break, let's continue to have this discussion, maybe go through some of the clinical signs that you see with Johne's.
Sounds good.
You're watching DocTalk, and we're sure glad you joined us.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information.
Got cattle? RotoMix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, RotoMix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. RotoMix, proud to offer a better mix in less time using less fuel.
Be ready for breeding soundness exams with Neogen's new and improved Electro Jack 6. Features a new wireless design, improved waterproofing, and more power for quicker and easier collections. Its newly designed probe features a tapered angle for easier insertion, and new rubberized material adds durability. Electro Jack 6 can be used with rams, boars, and bulls of all sizes. To order or for more information, contact Neogen at 800-621-8829 or your local animal health distributor.
There's something wrong. His head is down. He's clearly stressed. He's worried sick about BRD. That's why there's prescription Zactran for BRD treatment and control in high-risk cattle. Get a rapid response plus 10-day treatment and control in a single dose, so you can stop worrying and get back to business. For use in cattle only, do not treat cattle within 35 days of slaughter. Because a discard time in milk has not been established, do not use in female dairy cattle 20 months of age or older or in calves to be processed for veal. The effects of Zactran on bovine reproductive performance, pregnancy, and lactation have not been determined. Don't worry yourself sick. Talk to your veterinarian about a real alternative for BRD treatment and control. Because it's critical, it's Zactran from Mariel, a leading animal health company.
This segment is brought to you by your Beef Quality Assurance Program, BQA, building consumer trust through your commitment to quality. Learn more at bqa.org.
Hi there and welcome back to DocTalk. I'm Dr. Dan Thompson here at the College of Veterinary Medicine at Kansas State University, and I'm joined by Dr. Matt Messner, who's an assistant clinical professor over in the veterinary teaching hospital here at K-State. And Matt, you spend time on our clinical floor working with cows and sheep and goats. One thing about Johne's I never really understood. I always understood the bovine side of things, but I didn't understand the sheep and goats.
Sure. Yeah, it's one of those bacterium that there's different strains of it, of course. I mean, cattle strains and small ruminant strains, and they essentially do the same thing in just a little bit different infectivity. You know, so some strains of sheep really don't really infect cattle, you know, but there's rabbits. Mostly it's ruminants and other things that get it. Primates, they can experimentally infect it, but it's not a natural type of
it's not a natural disease. When we're looking out there at that cow herd, you know, and the veterinarian, of course, we always encourage that you work with a veterinarian and get proper diagnostics, but what would be some examples of cow herds out there that would be suffering from a Johne's disease problem?
So the clinical signs, if we think of the classic Johne's animal in cattle, it's an animal that is bright and alert, but just wasting away. Okay, they're just skin and bones. But they just eat everything inside, and it's not till later on, towards the very terminal side, that they'll just have a really pipe stream, watery, pea soup type diarrhea. You know, just profuse.
Now this is in an older animal.
Sure. Most common ages would be around 4 to 6 years. Occasionally with infective doses as calves, I've seen them up to 7 or 8 years, so a little older cow. You know, things that we would put on the list is maybe it's parasites, maybe she's just getting short in the teeth and kind of having trouble digesting, you know, other old cow diseases. But usually it's about 4 to 6 years old, and they waste away, they eat profuse watery diarrhea. Sheep and goats, about the same age, okay, maybe 2, 3 years old, and I've seen it that early in cattle. But they generally will waste and eat, but they don't get the diarrhea. That might be a little bit soft, but instead of pelleted manure, it's just pasty. You know, they just don't get the diarrhea.
So it's not the hose pipe.
Right. Exactly. Yeah.
And now, outside of that, you know, is there any predilection for, you know, males, females? You know, is it?
Everybody's fair game on this one. It's picked up as a young calf or lamb or kid, and then males, females, it all manifests the same.
So when you know, I asked you a question a little bit earlier about, you know, one of the things that we have an issue with, you know, can it be like higher prevalence within a herd, or does it seem to follow in pockets, or is it just kind of something that's across the board?
Absolutely. I mean, the biggest thing that we see is close confinement. And that's why the dairies have been aware of it a little bit more often, because it's more likely to be in higher concentrations, closer confinement, easier to transmit. Whereas, you know, the beef herd is kind of spread out. But you can have hot areas where they had a shedding cow that was passing this bug into the environment, and others picked it up. Calving areas, those kind of things.
Okay.
But we see it more commonly in really concentrated herds.
Well, I think it's important to know, and especially when we start to think about, you know, we generally think about spreading animals out and changing the environment to prevent neonatal calf scours. Looks like some of the same management techniques we use there might help us decrease Johne's.
Yeah, and a big thing that we talk about, they don't show clinical signs until they're 4 to 6 years old, but they can be putting it into the environment that whole time, you know. So
it's a devastating disease, Johne's disease in cattle. After the break, we'll be back with Dr. Messner. Thanks for watching DocTalk.
This segment is brought to you by Lalaman Animal Nutrition, dedicated to the development and production of natural and differential solutions for animal nutrition.
There's something wrong. His head is down. He's clearly stressed. He's worried sick about BRD. That's why there's prescription Zactran for BRD treatment and control in high-risk cattle. Get a rapid response plus 10-day treatment and control in a single dose, so you can stop worrying and get back to business. For use in cattle only, do not treat cattle within 35 days of slaughter. Because a discard time in milk has not been established, do not use in female dairy cattle 20 months of age or older, or in calves to be processed for veal. The effects of Zactran on bovine reproductive performance, pregnancy, and lactation have not been determined. Don't worry yourself sick. Talk to your veterinarian about a real alternative for BRD treatment and control. Because it's critical, it's Zactran from Mariel, a leading animal health company.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription NoraMeissen 300LA from Norberg, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. NoraMeissen 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norberg's NoraMeissen 300LA is the practical choice for your herd.
America's ranchers and farmers have had a long-standing commitment to quality, and now the Checkoff-funded Beef Quality Assurance Program is working with you to improve our product for consumers. At bqa.org, you'll find an array of educational materials about BQA. You can also take our online course for BQA certification. BQA, it's a commitment to quality, it's a process for continuous improvement, and it's about doing the right thing.
This segment is brought to you by Norberg Laboratories, manufacturers of NoraMeissen LA, Normectin Plus, 1%, and Poron, the practical choice for your herd. Hi there and welcome to DocTalk. I'm Dr. Dan Thompson, and I'm joined today by Dr. Matt Messner, who is an assistant clinical professor here in the Veterinary Medical Teaching Hospital at Kansas State University. And Matt, it's always a pleasure to have you here on the show, and we're talking about something that's a devastating disease to individual animals specifically that get this, and it can be economically devastating to a beef herd. We're talking about Johne's disease, and one of the questions that keeps coming up is, can I just go test for it?
Right. Yes and no. The disease itself is really hard to detect as far as blood tests and those kind of things early on. That's the the main focus of a lot of research now is trying to see how we can pick these animals up early on before they show clinical signs, because they're passing it into the manure, into the environment before they ever show those signs. And a bunch of detailed stuff goes into that, but there are blood tests that can test it, okay? Positive tests in a very clinical animal is really believable. Some of those testing that you do just randomly, you'll get some false negatives on that kind of thing, and sometimes some false positives. The kind of still the gold standard would be to look in the manure and try to culture it and grow it. Okay, so, but again, that's a hard to grow bug. It requires some special media. It takes time to get that done. Right. Some newer tests and some PCRs. There's some testing that you can do. It's just selective, and so my recommendation usually is if we have skinny animals, thin animals, maybe if we want to start surveying, maybe we've had one die, let's start picking out some of these.
Yep.
And then we do some environmental cultures. They can do fecal cultures in dairies or areas where we have concentrated manure, and kind of survey that, or kind of
like a bulk tank test, only you're looking at all the feces, bulk feces test. And you know, I think it has been a work in progress of trying to get a good diagnostic test for this crippling disease.
Sure. Yeah. I mean, and there's some individual things when they're really showing clinical signs. I can generally come up with a diagnosis, and then we just have to interpret it and kind of go from there.
Always work with a local practitioner on a diagnostic plan. Well, what are some of the things or keys to managing Johnes?
So a lot of people, they either discover it by necropsy or for some other reason to get a positive animal, and you'll want to address it. I mean, I think it's the right thing to do is to address it, because it could have spillover effects as managing better things and other diseases throughout the herd. But some people are a little hesitant because they don't want anybody to know they've got Johnes, and there's a possibility that it's reportable. Well, I'll say it's surveillance, but the government's not involved in any specific things right now. But you know you have it, and then so since there's not any reportable regulatory things specific for it, I mean, I think it's time to just be proactive and start getting rid of it. Big thing is cleanliness is the biggest thing, and if we discover it, we want to start keeping the concentration of those animals that were clinical out of the rest of the herd. Cleaning up manure, cleaning up pens, calving facilities, kind of areas we might want to rotate, and anything that's showing diarrhea, we may want to get rid of. Any offspring that were born to a positive animal, we may want to cull those early, because we won't know if they have the clinical signs or the disease for sure due to limits on testing until they show it later on. So
it's one of those things that the things that we do to prevent fecal oral transmission or neonatal calf scours, same rules apply to Johnes.
Absolutely. I mean, and that calf or lamb or kid, right after they're born, that's the most susceptible, up to a couple of months. And so we may start heat treating colostrum in some small ruminant herds. Everyone's going to be a little bit different, but cleanliness and prevention of that manure getting taken.
What about those colostral supplements and things like that are spray dried instead of, you know?
Sure, and those they're a lot better quality now, you know, and there's some really good ways to get IgG or immunoglobulins into those calves and lambs early on without having to go the colostrum route.
Yeah.
And so that might be a management strategy we go. But the biggest thing is just trying to keep the manure out of that young animal's mouth.
Yeah. Well, I think it's important that we understand that the gold standard test then is the culture.
Sure.
And it takes forever.
It takes a while, yeah. They have some speed up medias now. Those are getting better. And you know, biggest thing is knowing where you get new replacements too. I mean, like I said, the sale barn can carry a few, and if you don't know what you're getting, you could potentially bring it on, or you know. So you just gotta pay attention to everything that's kind of coming new onto the place.
Make sure you work with your veterinarian. We're watching DocTalk. We'll be right back.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
This is Agriculture Today from Kansas State University. The three leading wheat varieties grown in Kansas, TAM 111, Everest, and Armor, have proven their worth as top yielders, but have now lost part or all of their resistance to stripe rust disease. Does that mean that next year and beyond growers should steer clear of planting those varieties? Absolutely not, says K-State agronomist Jim Schroyer.
Would I throw them away? My goodness, no. Those varieties are excellent yielding varieties. They will now respond to a fungicide. I think we really do have to think about fungicide use. We have to budget that into our equation based on the varieties that we're growing.
Another example of what's happening in agriculture today from K-State Research and Extension.
Cow-calf, stalker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norberg offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the NoraMeissen line from Norberg is the practical choice for your herd.
Here in Dallas, we're proud that our vehicles use an advanced biofuel called biodiesel. It's made from renewable resources like soybean oil, canola oil, even recycled cooking oil. This year, biodiesel will displace almost 1 billion gallons of fossil fuel nationwide. Our air is cleaner, our economy is stronger, and America's more energy independent. It's working here, it can work in your community. Biodiesel, America's advanced biofuel.
Welcome back to Doc Talk. Dr. Dan Thompson here at the College of Veterinary Medicine at Kansas State University, joined by my friend and colleague, Dr. Matt Messner. And Dr. Messner is an assistant clinical professor here in our veterinary medical teaching hospital. And we're talking about Johne's disease. And the one thing, we talked about how Johne's is in sheep and goats and cows. And the one thing, that you see in the media is maybe Johne's disease is related to Crohn's disease in humans.
And certainly it's a similar pathologic process that we see with Crohn's disease in people and cattle or sheep and goats with Johne's, okay? Meaning inflammation of the intestine. And so over and over, occasionally you'll find they've found possible DNA fragments or something from a Johne's, but over and over it's been proven that Johne's organism is not the cause of Crohn's. It's maybe an associative kind of accidental discovery of some part, but many studies have been shown that it's not. And actually the incidence of Crohn's disease actually sometimes a lot less in agricultural communities and people with cattle and higher exposure to the disease. The actual Crohn's disease is a lot less prevalent in those. So it's one of those where it was a fear, and they monitor it closely, but over and over it's been not to really pan out. So.
Yeah, there's a lot of researchers and experts out there in the Crohn's field that specifically monitor and do research to see if we have this disease, if there's a relationship between Johne's and Crohn's disease. And sure. I've yet to see a paper.
I have not seen it. Yeah. But they continue, and that's great. But the vast majority of evidence is saying that it's not related.
It's another example of us being fortunate enough to live in a country with the world's safest food supply.
Mm-hmm. Yep.
And we keep tracking. It doesn't mean that we sit back on our laurels and keep monitoring, but at this point in time, science sure isn't pointing in that direction. Right. Anything else on Johne's before we wrap up?
Well, you know how it's spelled. It's kind of, we talk about Johne's, but everybody wants to know how it's spelled. And it's spelled John with an E on the end of it. And somebody say Johne's, kind of thing. So it's John with an E. If you look it up on the internet, lots of information out there.
Thanks a lot for joining us today. It's been a great show. And thank you for joining us today on Doc Talk. If you want to know more about what Dr. Messner and I do here at the College of Veterinary Medicine, you can find us on the web at www.vet.ksu.edu. Remember, always work with your local practitioner. I'm Dr. Dan Thompson. You've been watching Doc Talk. We're sure glad you joined us, and we'll see you down the road.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by MultiMan USA, manufacturers of MultiMan 90, sure trace mineral supplementation by timed injection.
We've been using the MultiMan on our donor cows, and after we started using it on them, we've seen a definite increase in grade number 1 embryos. I like the results that I get using MultiMan with the AI conception rate.
Their minerals not up to snuff, you're going to have problems, and I definitely think MultiMan is good for, general healthiness of the cattle.
We think MultiMan more than pays for itself.